everyone, and welcome back to Medtalks with Dr. Syed Raza. And today I'm your host again, Dr. Ghazal Saxena. So, a little about Dr. Syed Raza. He's a senior cardiologist, physician, author, public speaker, and founder of the Raza Foundation with over 23 years of experience in preventive and cardiovascular medicine. So, I'm really delighted to have him here and again to discuss a few very interesting and important topics. And I'm really looking forward to having his insights. So, welcome, Dr. Raza, again to this wonderful conversation. And we hope to learn a little bit more from you again.
Thank you so much, Dr. Ghazal, for that very kind introduction. And I'm really glad to be here with you again. And I hope we'll have a very fruitful discussion. And I believe the others will benefit from this discussion as well.
So today we'll be discussing about one of the very common topics which needs actually a lot more attention. How our oral health and cardiovascular health are related. So we would love to get to know a lot of insights from Dr. Syed Raza today. And yeah, I'm very excited. So to begin with this session, Doctor, can you please tell us that can gum disease really increase the risk of heart disease, or is it just a simple association? What do you think is the real thing behind it?
Yeah, that's a good question to start with, Dr. Ghazal. Now, many people would not know what is the connection between the oral health and heart health, but there is. And research has actually shown that people who suffer from periodontal disease, there's 3 to 4 times increased risk of cardiovascular event.
Right.
So that is probably not known to many. And how this happens, it can happen in two ways. Either there is a direct bacterial invasion, bad bacteria, that originates from the mouth or oral cavity. And it may be due to a bad gum disease or decayed teeth and others. And they get into the bloodstream and they go and dislodge in the inner lining of the blood vessels in the heart. So this is called and they lead to inflammation and therefore plaque building and eventually lead to heart attack and stroke later on. The second way is systemic inflammation, where the body's own response generates some proteins, inflammatory proteins, and that can again lead to damage to the inner lining of the blood vessels. So these are the two ways that the bad oral health can lead to cardiovascular event.
Right. So this highlights a very important association between our oral cavity and our heart health. So it is very important that a particular hygiene is maintained because there are, as we know, there are two kinds of bacteria. They can be good colonizers and they can be bad colonizers. So the bad colonizers, if they migrate throughout the body, they can cause issues like this and they can even cause infections in your heart. So it is very important to take care of your gum health and your oral cavity as well, because what happens inside your oral cavity can have consequences which are more dire than anyone could think of. So definitely. So doctor, what lifestyle habits do you think can protect both our oral health and our heart health?
Yeah, I think most important is brushing your teeth. And correct me if I'm wrong, that brushing your teeth twice is advised. And I've read, I would say, is 2 minutes of brushing teeth. What is your opinion? Is that 2 minutes? You being a dentist, so is that 2 minutes that's advisable?
Yeah, definitely. 2 minutes, 2 to 3 minutes is a very decent time to go ahead with brushing. And honestly, if someone tells me that, okay, I am brushing once a day, definitely it is recommended that you brush 2 times a day, or after meals, you at least, use a mouthwash, or, you just keep the oral cavity clean. But if someone tells me that they brush 1 time a day, but if they're brushing properly, they're following the techniques or the right techniques of brushing, that can also be enough. Definitely, it is recommended that you brush twice and preferably with a soft bristled toothbrush. However, it's not necessary that you have to brush twice only. Like sometimes if you miss out, it's all right. But the one time that you're brushing, you have to do it properly and clean your entire oral cavity, be it your tongue, be it your teeth, using a dental floss and everything. These little things make a tremendous change, and this is something that a lot of people don't really notice. So yeah, definitely. That is one lifestyle change, as you mentioned.
And the other thing I believe is important is obviously to make sure that you do not consume a lot of sugar,
Yes.
sugary drinks, particularly
Right.
food which are carbohydrated, which is high in carbohydrate, I would say, and
Right.
processed food. They're not good for your oral health and your heart health
Absolutely.
either.
Right. Right.
And smoking is another one. Chewing
Yes.
tobacco. A lot of people
Yes.
have the habit of chewing tobacco, smoking,
Yes.
drinking
Right.
alcohol. They're not good. And
Yes.
it applies for both. Getting your dental checks from Dr. Ghazal and
Yes.
having your
Yeah.
regular heart checks
Right.
with me,
Yes.
with a cardiologist. So this helps. Now, on
Right.
that note, I just wanted to ask because say I've never timed myself,
Right.
for how many minutes I brush. But I see some people they are very particular in cleaning their tongue as well.
Right.
So, what is the idea? So, you feel that the bacteria can originate from the tongue as well? Is that possible?
Absolutely, absolutely. And it is a thing which a lot of people don't do. Like brushing your teeth and cleaning your heart tissues or the teeth is not enough. The tongue harbors a lot of detrimental bacteria. And over time, it gets accumulated and it can cause things like bad breath or odor, which can be very unpleasant. And overall, definitely those, because the bacteria they keep on multiplying, so they can migrate to other areas as well. So overall it can cause a lot of issues. So just cleaning your teeth, to begin with, definitely you have to clean your teeth, but you have to go the extra mile and combine it with cleaning your tongue as well, preferably with a good tongue scraper. Or sometimes there are so many toothbrushes in the market that are available with tongue scrapers attached to the toothbrush. So that is one alternative, but it is always good to have a tongue scraper in place. And yeah, as Dr. rightly mentioned, keep on having consultations with the dentist, whoever is near you. And if you're near me, you can come to me as well. So yeah, definitely.
Yes, I think that
Yeah.
that aspect probably a lot of people they do not know that you have
Yes.
to take care of your tongue as well. Yeah.
Yes.
And
Yeah.
one thing I would add here, Dr. Ghazal, because hydration, I believe, is important.
Yes. Right.
So if we do not maintain enough hydration, of course,
Right.
it adds to the bad breath and it will lead to accumulation of the bacteria. And there
Right.
are people, again, the gargling is another one.
Yes.
You have to gargle after eating meals because that
Yes.
leaves, particularly if you're going to retire to bed or sleep, and
Right.
after eating a particularly a sugary meal or something that is high in sugar content, and then you go to sleep without brushing your teeth and gargling and cleaning your mouth. So
Right.
that probably leads to accumulation of bacteria as well.
Absolutely. And these bacteria can definitely migrate to other areas of your body. So, definitely, it'll have an impact on your overall health. They say there's a very nice saying that your oral cavity is a mirror of whatever is going on in your body. There are so many diseases or syndromes out there which reflect in the oral cavity first. So the oral cavity is like a warning sign that okay, something might be wrong. For example, if someone has severe periodontal issues, severe teeth mobility, they need to be aware, okay, can these bacteria actually migrate to my heart as well or other area organs of the body and cause damage? So that is definitely like we've already discussed in our previous podcast that all the organs and the systems in our body are interdependent. Everything goes and walks hand in hand.
Yeah,
So
very true.
definitely,
Yes.
yeah. Yeah, so definitely taking care of your oral health is very, very important. So, doctor, that being said, there's a very common misconception amongst the general audience that professional dental cleaning or sort of any professional dental procedures can cause heart issues. So, do you agree with that?
No, if the individual is healthy, meaning thereby if they have healthy heart, then of course this does not pose any risk. to a healthy individual with a healthy heart.
Right.
But yes, any kind of dental procedure that is being done, even a deep cleaning, poses a risk in a few category of patients, I would say. One, those who have got prosthetic valve, artificial valves.
Right.
The second category of patients will be who already have had a previous infection in the heart valves, which is called infective endocarditis. The
Yes.
infection of the valve, infective
Right.
endocarditis.
Right.
Third category will be those who have some structural heart disease, which is not corrected surgically. So these are
Right.
congenital heart disease, uncorrected. And a fourth category of patients will be if they have got a severe problem with the valves, a leaky valve particularly, yeah,
Right.
a severely leaky valve, or there are holes in the heart. Yeah, so these
Right.
are again a congenital heart disease which holes in the heart. So
Right.
these are some of the category of patients. If they have these heart issues, then certainly they are at risk of boring infection on the valves and the other areas of the heart, which can
Right.
cause what we call infective endocarditis. And
Right.
therefore, this should be known to the dentist,
Yes.
and it is again the responsibility of the patient to
Yes.
tell to the dentist, because dentist may not know that you have this underlying heart condition,
Right.
and so that the dentist can take adequate precaution. And
Right.
generally, it is the antibiotic which is prescribed. This is called a prophylactic antibiotic. So
Yes.
the antibiotic is given, just a single dose of antibiotic is enough. That is
Right.
given prior 30 minutes to 60 minutes of the dental procedure or cleaning.
Right, right, absolutely. So it is the duty of the dentist and the patient as well. So having an overall idea of what is exactly going on with their general health is very, very important. And this is where the medical history and the past history and everything comes into place. So definitely, yes.
Absolutely.
Right.
Absolutely.
Right. So, doctor, one thing that just comes to my mind, as these days we know that a lot of antibiotic resistance is happening, and it is a major issue that has come into place. So, doctor, especially in dental procedures or dental cases, when is antibiotic prophylaxis really needed? Like, when do you think can a dentist really go for antibiotics?
No, as I mentioned, the category of patients,
Right.
four category of patients. So those are the patients who would need the antibiotic prophylaxis. Now you mentioned the antibiotic resistance. Now, if you look any guideline, they start with the simple antibiotic, like
Right.
a penicillin-based antibiotic, amoxicillin, oral amoxicillin
Right.
tablet, that is recommended. But you're very right that there's so much of resistance going on with the overuse and misuse of antibiotics that the bacteria, the antibiotic may not be very effective. So there's no right or wrong answer, and obviously you choose the antibiotic as per the guidelines. Whether this
Right.
antibiotic is going to work or not, I think that's a very important thought and subject
Right.
you have introduced here. So we
Right.
have got to be wary, and it is only again in the history we may ask the patient. Of course, we ask for the allergy, and then we give a different antibiotic, but also ask that if there has been some resistance to some antibiotics in the past, some
Right.
infection, that antibiotic may have been given and it did
Right.
not work.
Right.
So that's, I think, the best we can do for the patients. And if we suspect that there is a possibility of antibiotic resistance, then of course we have to choose a different antibiotic, maybe a little bit stronger, and that
Right.
may work for this
Right.
purpose.
Right, absolutely. So I completely agree with what doctor has just mentioned, rightfully mentioned, that it is very important to have a brief idea of what is exactly the patient's medical history. It is the duty of the dentist. Any dentist who is watching this, it is very, very important that the medical history is taken into consideration. And if there is something that you feel is not correct, or you need any expert advice with, I personally and professionally believe in taking a physician's consultation, their consent, right? And this is very, very important, as doctor has mentioned about infective endocarditis, which is quite common. It is very important that if as a dentist you come to know that the patient is suffering from some cardiac issue or some other issue in the body, it is very important that you take consent by the physician as well. So the healthcare community is always working together, and this is how, the dental community and the medical fraternity, we can collaborate, and it is always good to refer when it is needed. So yeah, definitely I agree with whatever points you've mentioned, and I hope that everyone who's watching this will take this into consideration, and a little pointer for all the patients or any general audience who's watching this. Please take care of your oral health. Please make sure that you are cleaning your teeth properly, you're following the proper measures. See, and there is nothing like a good toothpaste or a bad toothpaste, right? If you brush properly and the mechanical part is taken care of, everything will be good. Take care of your gum health and take care of your overall health, and definitely visit the dentist whenever you feel it is fit. And if you suspect something, you must visit the cardiologist as well. So yeah,
Yeah.
definitely.
And
Correct.
again, Dr. Ghazal, like any other medical specialty, I believe you'll see more patients when they have toothache. Probably that will be the one of
Yes.
the reasons that the
Right.
patients will visit the dentist, because otherwise,
Yes.
if they have no symptoms, they
Right.
may be having a tooth decay for years together. They'll not see the
Right.
dentist. But once
Right.
they have this tooth pain, and toothache, as you know, is a very, very painful condition, that's the
Right.
time they may rush to you
Yes.
and get an opinion.
Right, right, right. So thank you so much, Doctor, for highlighting so many points and telling us the correlation between our oral health and our cardiovascular health. So thank you so much for your wonderful
Thank you.
insights.
Thank you so much.